Well, good morning. Welcome back to the Broadcast Retirement Network. I'm Jeff Snyder. This is BRN AM for Friday, November 11th, 2022. And our top story today, you may be losing your hearing and not even know it. And joining me now to discuss this and a lot more, Julie Norin is an audiologist and professor at Towson University. Julie, it's great to see you again. Thanks so much for joining us on the program this morning.
Sure. Thanks for having me. I'm happy to be here.
And a bit of a new environment for you. Now, not only are you seeing patients, you're also teaching some of America's future audiologists. Let me ask you first, is there a deficit of audiologists in this country? Because hearing is so important. And what we've learned on this program is that there is a deficit of certain specialties in the medical field. But from your perspective and Towson University's perspective, is there a deficit of audiologists?
I don't think so. I think there's actually increasing interest in the profession because it's been talked about so much in the media lately with the different news and regulations that have come out, which we can touch on in a bit. But we are seeing an increase in enrollment in our Doctor of Audiology program. So I think that's a positive. We're not seeing that kind of deficit as we're seeing in other medical fields where professionals are feeling burnt out or feeling frustration with the systems and insurance and how all of that works.
Yeah. And what's it like balancing seeing patients with mentorship? I know that's big on your list is helping other, remembering you from where you came and then leveraging all your expertise and experience. What's it like teaching future audiologists?
Exactly. I remember well being a student and learning about this profession and building my skills. And the one thing that I would say made me the provider that I am is having excellent teachers and mentors. And I was fortunate. I went through Towson University's program. They have one of the stronger programs. And I have supervised many students going through programs from different schools around the country. And I continually go back to Towson as being some of the stronger students that I've had. And it's always been my desire to take on that role and mentor and teach students the way that I had when I was going through that program. So I really enjoy it. Yeah. I love being in that environment where I get to share my expertise and help them build their skills and watch them develop into competent clinicians.
Yeah, I can tell. I mean, just your demeanor, your action. Yeah. There's a glow about you. Let's talk about hearing. And when we last had you on, and I want to say this is over a year ago now, you underscored you were with the Hearing and Speech Agency helping students there and helping people there. Where are we with hearing and hearing tests in this country? Are more and more Americans getting the signal, that to get their hearing tested?
I hope so. I think that there's been a big push by not just audiologists, but just the medical field in itself, as well as industry, to encourage people to pay more attention to their hearing. And it's been our experience that a lot more primary care physicians are building in hearing screening and questions about hearing when they're doing annual checkups with their patients. So we are seeing more people take it upon themselves to contact us, schedule appointments, get that baseline hearing test, or just monitor their hearing if they know that they already have a hearing loss so that they can stay on top of it. There's been a lot of studies that have shown correlations between hearing loss and untreated hearing loss and other conditions such as cognitive decline, as well as the propensity to fall and injure yourself. So I think the more that people are aware of those things, the better it is. And hopefully we will continue to see that increase of interest in monitoring their hearing.
Julie, you can be of any age and lose your hearing. You could be a 20-year-old who works with heavy machinery, goes to rock concerts like I used to do, and not bring hearing protection. go to gun ranges, to target practice, whatever. So it doesn't necessarily, this is not something, by the way, that inflicts or affects people 50 and older. You could be a younger person and have hearing loss.
Exactly. Hearing loss does not discriminate. So in my profession, over the course of my profession, I have treated and diagnosed hearing loss in patients of all ages, ranging from prematurely born infants all the way up to elder and geriatric patients. So we're talking 100, 105, still active and working on making sure they can hear what's going on around them. So not only is it important to be aware that hearing loss can happen at any time, most certainly if you've had that noise exposure, you're going to damage your auditory system. And if you did have that predisposition for developing an age-related hearing loss, that age-related hearing loss might happen a little sooner if you've had that unprotected noise exposure. So we always want to encourage people to be aware that this isn't just something that happens to old people. This can happen to anyone at any age. And we really want you to be cognizant of how your hearing can impact you in all facets of life.
So Julie, where would I get a hearing test if I'm hearing this for the first time or seeing this or reading this in closed caption, because our stuff's available in closed caption? Where would I go to get a test? Do I go to a place like Towson University? If I don't live in Baltimore or in Maryland, how can I find a clinician to help me do a test?
Sure. Well, the easiest thing to do would be to Google for audiologists in your area, and a list would likely pop up of audiologists that are in the area who can perform a comprehensive evaluation. And you can certainly come to Towson University. We have a full service clinic here where you are seen by student clinicians who are studying in the Doctor of Audiology program, but they are supervised by licensed and credentialed audiologists like myself and my colleagues. So you're never left with just a student by yourself. And we do actually have the luxury of spending more time with patients who come through our clinic because we give our students a lot more time than someone might have in just a regular private practice or ENT clinic. But I will encourage your viewers to ask a professional what their credentials are, because there are differences between audiologists and hearing instrument specialists and hearing aid dispensers. And the types of testing that an audiologist might do isn't typically done by those other professionals. So if you're looking for a comprehensive assessment, you'd want to make sure you're being seen and evaluated by an audiologist.
And Julie, is this something that is covered by insurance or Medicare or Medicaid? I mean, some people have health insurance, some do not. Some are on Medicare, some are on Medicaid. Does it cover? Yeah. It seems to me that with cognitive impacting cognitive abilities, this is something that primarily would be covered, especially to get a baseline.
Yeah. So insurance, there's that could be a whole other webcast, and we can have a whole hour-long conversation about that by itself. But in brief, Medicare will cover a comprehensive evaluation for hearing once a year, provided it's just to monitor your hearing. So if you're someone who wants to stay on top of your hearing and you feel like your hearing has changed, you can get that referral from your primary care physician. That primary care physician can refer you for a hearing test. You can go to any audiologist who accepts Medicare, and Medicare can be billed for that test. Medicare cannot be billed without that referral, though. We're pushing to get that change, to get what's called direct access, so that we don't need that referral and patients can just come to us and we can go ahead and bill Medicare without that primary care referral. But for now, that's the rule. So that's the process. For someone that has Medicaid, testing and hearing aids are covered. So there are some restrictions based on age and degree of hearing loss as to what type of coverage you would get with regard to hearing devices. But you can be seen by a Medicaid provider, and then Medicaid can be billed for those devices. In terms of commercial insurance, coverage is going to vary depending on the plan and the company that the subscriber has. So it's always best to reach out to your insurance company and determine what your hearing benefits might be. You might be restricted as to the amount that's covered, or you might be restricted as to where you can go.
Julie, last question before we go to a commercial break. The hearing test itself, I've done it a couple times. You sit in a booth and you hear different ranges of tones. Some are light, some are high, etc. Is that typically what it's like? And you have to click a button to say where you heard it and all that kind of good stuff. So it's not painful.
No, not at all. And in fact, that's just one small part of the testing that we do. When you do visit an audiologist, we are doing that test, which is called pure tone audiometry. We're testing to see the softest level at which you can detect the different beeps, whether they're low pitch or high pitch. And then we determine your average hearing loss based on where your thresholds are. But we're also testing your middle ear function. We're testing to see how well your eardrums are moving. We're testing to make sure that a reflex is working in your middle ear. And we're also taking a look in your ears and making sure we're not seeing any indication that you would need medical treatment, such as for a ruptured eardrum or an active ear infection or anything like that. I have seen some signs from patients that have come through for basic testing and referred them based on some of the red flags that I've seen. And then they've gone on and gotten medical treatment. And had it not been for my referral, that would have gone undetected. So there's a lot that we're doing when you're coming in for that evaluation, but everything is painless and it's actually kind of fun.
Yeah, I'm a big wimp, so I don't like pain. Julie, I want to take a very quick break. When we come back, we'll talk about finding hearing aids, new regulation, and a lot more. You're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms, especially for the smaller businesses? I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network.
Are you over 50? Would you like to get up to 33% more income in retirement? Then call now for this free book, Annuity Do's and Don'ts for Baby Boomers. This free book reveals little-known secrets about annuity strategies that will help you make the right choices before buying an annuity. Call right now for your free book, and as a bonus, we'll also throw in a free annuity rate report, both absolutely free for calling Annuity General today.
Call 800-504-8194.
Welcome back. We're talking this morning to Julie Norin of Towson University. Julie, thanks so much for sticking around with us this morning.
My pleasure.
All right, and by the way, I can hear you just loud and clear across the ranges, at least for what I can tell. All right, Julie, let's talk about something really important, and that is the hearing aid. Oftentimes, people who lose hearing, whether they're young, old, middle-aged like myself, they may get fitted for a hearing aid. First, what do we need to know about getting those hearing aids? Is it a fitting? Does one size fit all when it comes to the hearing aid?
No, and that's why it's so important to take that first step meet with an audiologist, get your hearing aid evaluated so that you can establish what your hearing thresholds are, and then talk with that audiologist about what the different options are that are available for your specific treatment. The selection of a hearing aid is going to be based on your hearing levels. It's going to be based on your lifestyle and your listening needs. It's also going to be based on your budget. So there are a lot of things to consider when going through that process. And the best course of treatment is to meet with someone who has that knowledge and expertise so that they can guide you through that process.
And these devices, I mean, I remember in the old days, that they were over the ear, they were very conspicuous. Now these devices fit in the ear. You might never know that someone is using a hearing aid, so people don't have to be as cognizant or conscientious about that. Because I think people are oftentimes conscientious about things like that.
Oh yeah, there's a lot of people do feel very self-conscious about that, and I've had a lot of patients tell me that they're hesitant to use hearing aids because they don't want to look old. And in truth, in my experience, and I've had this experience with my own family members that are aging and have developed hearing loss, is that the hearing aids aren't going to be what makes you look old. It's your inability to follow the conversation accurately is what's going to make you look old. So the hearing aids are just going to give you back that quality of life. And they are incredibly small and incredibly inconspicuous. So there, again, tons of styles to choose from, but it's very difficult to really tell if someone's wearing a hearing aid unless you know what to look for.
And they're very sophisticated in the sense that they run off of Bluetooth. I know some individuals that use them because they have some hearing loss, and they actually can be tied and paired with a phone. They can be charged like a device. So again, we're talking about the latest, most modern technology that has evolved here, so people can really kind of shed those myths and dispel those myths of what the hearing aid used to be.
Exactly. Yeah. Not only are they really tiny, but they're very sophisticated. So some people would prefer to still continue using those small little battery pills that are disposable. They would need to be changed about once a week. But now hearing aids are coming with fully rechargeable batteries where all you have to do is take them off at the end of the day and pop them into a charger, and they'll charge overnight. And then you can just put them on your ears the next day. And most of those rechargeable batteries will last more than enough time for someone to get a full day's use. So we're talking close to 22, 24 hours. So you no longer run that risk of being somewhere and trying to listen to something important and having your battery run low and having to change the batteries. And the upside of that is a lot of people do experience issues with dexterity, and handling those tiny little battery pills and trying to change batteries becomes more and more of a challenge. So the rechargeable batteries do eliminate that as a factor. And then lastly, touching on that connectivity with Bluetooth, absolutely. You can connect your hearing aids to your cell phone, and then your cell phone could be 30 feet away, and you can have a phone conversation through the hearing aids and listen to your conversation through the hearing aids. The hearing aids will pick up your voice to the person you're talking to. And it's just an ease of communication that you just don't get when you're trying to talk on a telephone and listen over speakerphone, or not being able to hear very clearly when you're holding the phone to your ear. So very different experience, but designed to function seamlessly in the way that we live our lives day to day.
Julie, the FDA, I was going to say the FBI, but they're not involved here, fortunately. The FDA, thankfully, just made it possible for over-the-counter hearing aids. And while that sounds very positive, what does this mean for, I feel like it's like, I don't have the personal expertise to buy a hearing aid, and the person across the counter may not have the expertise as well. What do we need to look out for if we do choose to go that route? What are some of the comparisons and things to be aware of?
Yeah, so interestingly, the FDA has come out with new regulations. Those regulations went into effect on October 17th of this year, what those regulations did was they essentially created a new category distinct from what are called prescriptive hearing aids, which the kind of hearing aids that I would dispense out of my office or that a licensed hearing healthcare provider would dispense out of their office. They created a new category of over-the-counter devices. The differences between what you can find over the counter versus what you would get through a licensed hearing healthcare provider, there are a couple of really big differences. One would be those over-the-counter devices are really designated for any individual that is 18 and over who has a perceived mild to moderate hearing loss. So someone who is younger than the age of 18, so a child who's struggling with hearing loss, would not be able to take advantage of those over-the-counter devices. In addition, someone who has a hearing loss that is greater than a moderate hearing loss would not be able to take advantage of those devices. Those devices would not be medically appropriate. There are some individuals that can most certainly take advantage of those devices. Some other differences that exist between the over-the-counter devices and prescriptive devices have to do with not just the devices themselves and the functionality and the output, because again, the output is really just designed for someone who has a milder hearing loss, but the price point. So hearing aids that are sold over the counter, they're saying, if you look in the articles that come out in the media, there was an article that came out in the Washington Post the other day that was excellent, talked about the average cost of hearing aids. A lot of people have in their minds that the average cost of a set of hearing aids is going to be breaking the bank, $5,000, $6,000, $8,000. That's not necessarily the case. Really does depend on where you go. It depends on the technology level of the devices that you're buying, and it depends on the provider that you're being seen by. Devices that are sold over the counter, what I've seen so far are about $800 a pair and up. So it's not that much of a cost savings when you know that you can go to a licensed professional, have them help you and guide you through the process, make sure you know what you're getting yourself into with a licensed professional, and have them take over the care for not that much more. So in addition, the last difference between the over-the-counter devices and the prescriptive devices is if you choose to go the route of purchasing something over the counter, you do not need to have a hearing test. It's not required. However, if you come see me and decide to go the route of purchasing hearing aids, we have to test your hearing. We have to know what we're doing and what we're fitting and what the hearing aids are doing to treat your hearing loss. That's a big thing. In my opinion, I'm not sure that it's smart to ever go the route of treatment without first establishing what the need is. So again, it's fine if someone has gone to an audiologist and has had their hearing tested, they already know their hearing levels, and they've determined that they don't have greater than a moderate hearing loss. If they feel that they are that tech savvy, they can certainly go the over-the-counter route. But in my opinion, the recommendation would be to meet with that audiologist first, establish your hearing levels, and let the audiologist guide you through that decision-making process.
Yeah, really important distinctions. Last question, Julie. Should have asked you this maybe at the beginning, but let's just talk real quick about ear care. Do we need Q-tips? What do I put in my ear to clean it? Ears get dirty like every other part of the body. So what do I need to do, or what does the audience need to do to keep it nice, clean, and tidy in there?
Yeah, we always say no need for Q-tips. I know there are a lot of zealots out there. They love cleaning their ears with Q-tips, and it feels good. We know it feels good, but it's definitely risky. We want to encourage people not to do that. There's actually not a need to do that. The ears are self-cleaning. The best thing to do is let the ear function as it's meant to and clean itself. And the easiest way to make sure that you're cleaning your ears is with a washcloth and soap, or do it in the shower. There are people that do have a tendency to build up earwax, in which case you might experience difficulty with your hearing and an earwax blockage, in which case you'd want to go to either an ENT or an audiologist and have that earwax removed. But otherwise, there is no need to use those Q-tips. And in fact, the Q-tips do the opposite. They might come out and look like they've got wax on them, but what you're actually doing is packing in whatever wax might currently be in your ear and making it harder for it to work itself out.
Yeah, really important information. Got to take care of your set of ears the best you can. Julie, we're going to have to leave it there. Great for you to stop by. Thanks so much for joining us, and we look forward to having you back on the program again very soon.
Sure, it's my pleasure. I'm always happy to be here.
Thanks, Julie. Great to see you as always, and thanks for sharing your perspective. That wraps up this episode of BRN AM. Have a topic of interest, someone you think we should talk to? Drop us a line, and don't forget, for all the news in retirement, markets, technology, personal finance, so much more all in one place, check out today's edition of our daily newsletter, The Morning Pulse. Want to search our archives, check out our latest content, or visit our website and all of our streaming partners. We're back again tomorrow for BRN Weekly. We'll be taking a look back at some of our best segments for the week. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes. Now is your opportunity to co-create content around any topic on the First Lifestyle and Wellness Network. Reach a global audience through our platform and co-own exclusive branded content. All of our programs are available on demand and also as audio-only podcasts, so you can take us on the go. Broadcast Retirement Network, available anytime, anywhere, and on any device.